Good afternoon. Thank you for watching our live update for Tuesday, January 12th. Today I have some information for you. When I'm done, Administrator of Assisted Living Sloan Verlander will be up to speak. She's been our point person for the vaccine, and she's going to provide you with our latest information about the vaccination effort. After Sloan, Glendon Kemp, Manager of Security, has some information about the SARA security system conversion that's underway. Then Gayle Haglund, Vice President of Development, has an update for you from the foundation. And then to close out today, Vanessa from Pastoral Care has some scripture and a prayer for us. I want to start out today and just thank everyone for what you're doing to keep each other and yourselves well and safe, and for that, we're very thankful. I just want to take time and acknowledge that you're doing a great job, and we appreciate it. It is so important for us to stay strong and vigilant in following all the protocols that we can so that we can stay safe. We've been discussing these protocols for what seems like a year now. It's actually only been 9 months, but we need to continue to wear masks, keep our distance, and when we don't feel well, check in with the clinic and isolate until we can get you tested. Thank you very much for doing your part, because it is working. The community is doing a great job of staying well, and for that, we owe it to you, so thank you very much. Westminster Canterbury is grateful that we can do our part by trying to allow whatever services we can safely, like being able to provide meal delivery to everybody in their apartments, offering appointments for fitness and aquatics, and resuming some limited services in our salons, and offering all the live stream performances here in the theater like you can see behind me. So we're really thankful that we can do all of that, and it's a big effort by the staff in all these different departments, and I'm thankful for that. So I just want to stop and say thank you for the sacrifices that you're making now so that we can weather this crisis and get to the end and stay well. So thank you very much. I'm grateful for each and every person that's part of the Westminster Canterbury family. As you are seeing in the news, and as we've been saying, and as we predicted, with the Christmas and New Year's holidays, we continue to see a rise in cases in COVID-19 throughout our region, throughout the country, and here in the region, and at Westminster Canterbury. Positivity rates for Virginia and the Central Virginia region are peaking at the highest levels that we've seen throughout the pandemic, and so it is very important that we continue to be careful. Today, we have several updates for you regarding cases and the vaccination process. I just want you to remember that ever since the beginning of the pandemic back in March, Westminster Canterbury has been following all the guidance that we get from the Centers for Medicare and Medicaid Services, the Centers for Disease Control and Prevention, and the Virginia Department of Health as we respond to all the changing things on the ground here. So there are some policies and protocols that we have in place that we can act on or make decisions upon on our own. A lot of what we share with you are guidelines or regulations that we get from these external agencies, and we don't have much room to bend those. So we appreciate your understanding. All these protocols, as painful as they've been and as difficult as they have been to live by, have done a good job of helping us weather our way through this pandemic, and we've done well considering and in comparison. So we need to continue with it. Thankfully, our whole leadership team has close connections to other leaders around the long-term care and CCRC industry throughout Virginia and really nationally. We're all pretty well connected. And through serving on the Governor's Long-Term Care Task Force and the Leading Age Virginia Board of Directors, I am able to hear directly from a lot of the leaders of other organizations about processes and policies, and I'm able to advocate for Westminster Canterbury and for our sector, the nonprofit CCRC sector, around a lot of these things. Today, I'm going to be going into what's happening in our community here, Sloan Verlander, who's been leading our vaccination process, along with Will Blackwell, is going to share the latest on the vaccination process and assisted living. So let me tell you a little bit about the COVID situation here on campus. I'm very pleased to report to you the good news that our resident cases have remained stable over the last week. You'll recall last week we had a few cases, and so at this time we have 5 residents who are being cared for in our COVID-19 positive unit. 3 of those residents came from Parsons Health Center, where we had a small little outbreak on 3rd floor. And 1st floor, I guess, the 2. We have 1 resident from the Gables and 1 resident from independent living. Thankfully, and very thankfully, all 5 are doing well. All of them are either asymptomatic or have relatively very mild symptoms. And so for that, we're very thankful that this current group is doing well. Additionally, we have a number of independent living residents that are in quarantine after being exposed to family members, friends, or personal independent contractors who are coming into their apartment who had tested positive for COVID-19. It's important that you remember that there are risks involved if you invite outside contractors or personal employees into your apartment, or if you go off campus and attend in-person gatherings. That's how these individuals were exposed, and so now they got to quarantine until for a period of time. And there's really no way to test your way out of quarantine. Once you're exposed, you have to wait out the incubation period before getting out of quarantine. So if you are exposed, you must follow the guidelines from the Virginia Department of Health. That's not up to us, that's up to the Virginia Department of Health, and that may include up to a 14-day quarantine. Following quarantine protocols is extremely important because that's how we keep from spreading this virus. We can be positive for a period of 7 to 10 days before we're going to test positive, and for a few of those days, we can be shedding virus and spreading it around. So it's really important that if we get exposed, we maintain quarantine to protect everybody else. We currently have a total of 15 employees who have tested positive for COVID-19 and are recovering at home or are asymptomatic at home. Since our last update, which I guess was Thursday, we've had 8 new cases in employees. These new employees work in dining, Westminster Canterbury Richmond at home, in the Genesis rehab team, resource development, assisted living, and 3 from the Parsons Health Center 1st floor. There are several others who are in quarantine due to experiencing symptoms that could be consistent with COVID-19 or after being exposed to someone who had tested positive. Due to the new employee cases on the 1st floor in Parsons, that floor is now in isolation and will stay in isolation for a period here of a couple of weeks. Non-essential employees and residents should not use the Parsons Health Center elevators to access either the marketplace or the clinic areas. Please go around. We can't have you in Parsons Health Center right now because of those cases. And then, not to be left out, our child development centers now. We've had 2 children who attend the child development center test positive for COVID-19. These are community children, not the children of an employee, but those 2 kids now are out after testing positive and are in quarantine. And per guidance from the Virginia Department of Health, 2 classrooms in the CDC, our young preschool class and our pre-K classroom, both need to be closed and quarantined during the quarantine period. So that's unfortunate, and it's hard on parents. We have a number of staff parents who now have to have their kids at home, so that adds a whole nother level of burden. Now, shifting the conversation to the vaccination process, and I know this is what you're all tuned in for. Sloan's going to share the details and the latest updates, but I know for a fact, because I've heard it from a lot of you, that you're hearing a lot on the news from your friends, your families at other facilities, or from professional contacts that you might have in healthcare. As a reminder, I want to be clear. Westminster Canterbury is not in charge of how this vaccination process will work for you or us. We were required to choose a pharmacy partner a number of months ago. Our options were either CVS or Walgreens. Only two options we were given. We chose CVS Health because we have a long-standing relationship with our CVS pharmacy here next to the clinic, and with Omnicare, which is a CVS company, which is our inpatient pharmacy provider, and that's who serves the Parsons Health Center. So CVS seemed like the obvious best choice. We were told at the time that both pharmacies would deploy the vaccine in the exact same manner based on guidance from CDC and the VDH. Now, it's clear CVS and Walgreens have different approaches to getting the vaccine rolled out to communities like Westminster Canterbury. I've heard from many of you about Cedarfield, Covenant Woods, Westminster Canterbury, Lynchburg, all moving faster than we are here at Westminster Canterbury. And that's true. I've spoken to all of those organizations, and they are moving at a pace that's different than ours. All of those communities chose Walgreens as their partner, and Walgreens is choosing to do the whole campus at one time, or at least overlapping the phases. And CVS has not been willing to do that. Our partner, CVS Health, is following the guidelines that Virginia Department of Health laid out for administering the vaccination clinics. Walgreens appears to have a different plan. And well, obviously, we'd like to be first, and this is not ideal for us. We are committed to getting you, the Westminster Canterbury residents, moved to the front of the line with CVS, or finding another way to get this vaccination process here on campus. We've heard from some of you that you found access to the vaccine through other relationships with other organizations or other means. If you can get it through other means, please, by all means, go. Get it if you can get it somewhere else. But we're going to get it for you here as quickly as we can. The last thing I'll say about the vaccination process before I turn it over to Sloan is that the process is going to change. You're probably seeing that on the news today. Now the federal government's changing its approach to this. The states have already changed how they're doing it. And so the whole thing's going to change again. This rollout has been a disaster from an operator's standpoint, from my standpoint. It hasn't been clear how it's going to happen. The communication has been almost what you might describe as terrible. And really, the providers don't, CVS and Walgreens, or at least CVS, don't appear to have the resources in place to deliver on this. I know many of you are mad to have to wait, and I'm right there with you. We are angry about this rollout too. You have every right to be mad. I'm as mad as you are. There's a lot to fault in the way that the federal and state governments have led this effort, and the pharmacies, both CVS and Walgreens, have done a terrible job of rolling this incredibly important effort out. And hopefully that will get smoothed out here and we'll get this thing moving a lot quicker. Westminster Canterbury Richmond has the staff, and we are ready to vaccinate everyone on this campus as soon as we can get the vaccine. But we cannot get the vaccine without the government and pharmacies' help. So I understand your anger, absolutely. I'm as angry as you are. And so we're going to get this as quick as we can, but please understand that Will, myself, Sloan, the whole team is fighting to get this here as quickly as we can, and we'll fight on your behalf, and we'll let you know as soon as we have more news. Lastly, I'm going to be away for a couple days, so others will be delivering the live updates this Thursday and then next week. Our next live update is Thursday, this coming Thursday at 3 p.m. Anita Atkins from the foundation, who has masterfully guided our communication effort through this entire pandemic, will be here in my place to deliver the COVID-19 update, and then others will be sharing the other information. So that's it for me today. I'm going to turn it over to Sloan. She can give you more of the details about the vaccine.
Good afternoon. Westminster Canterbury Richmond has been engaged in vaccination planning with CVS Health since early December. Westminster Canterbury is not authorized to control or administer the vaccine. CVS is maintaining the vaccine for us and provides everything we need for the vaccination clinics. It has been a slow process, as John described, of getting information on next steps. Westminster Canterbury is the 12th largest single-site continuing care retirement community in the United States, which makes us more complicated than other small communities when it comes to planning the logistics of the vaccination and managing the available number of vaccines. We are ready to proceed as soon as CVS Health confirms our next steps. All areas of living are prioritized to receive the vaccine in the first phase 1A of distribution. This phase includes all residents and staff in long-term care facilities, hospital staff, and first responders in Virginia. Our first vaccination clinic for Parsons Health Center residents and employees took place on January 4th and 5th. Over the 2 days, vaccines were given to 344 employees and contractors and 117 Parsons Health Center residents, for a total of 461 vaccinations. The date for the second dose is January 25th and 26th. Those who are eligible for the first vaccination clinic wave are receiving detailed instructions. Vaccination for the whole campus will come in multiple waves. There will be a separate set of vaccination clinics for assisted and independent living. We are following up regularly, and as John alluded to, we are definitely pushing for those dates to be scheduled as soon as possible. Please remember that both doses of the vaccine are necessary for protection. Protection is not immediate. It will take 1 to 2 weeks after the second dose before you are considered fully vaccinated and protected. The efficacy rate with the second dose is 95%. As an update for assisted living, the Gables in Monticello are in quarantine until Saturday, January 23rd. And again, to reiterate, when areas come out of quarantine, it means that residents may come out of their apartment, they can walk the halls close to their area of residency, and they may go outside. It does not mean that visitation is resuming. Visitation continues to be suspended in all areas of living. We are available at all times to schedule virtual visits with your loved ones. Up next is Glenn Kemp. Thank you.
Good afternoon. I have several things to talk about. I have an update on the Sarah Health Sense changeover. I have few announcements for resident services and then an important security message at the end. Sarah Health Sense changeover update. Westminster Canterbury IT staff and contractors are progressing well through the tower, replacing the Health Sense devices with Sarah equipment. Early on, we discovered a glitch in a few of the door equipment installations. The issue has been resolved. We will most likely finish the 6th floor today, begin work on the 5th floor tomorrow, and possibly begin the 4th floor at the end of the week. 5th floor should expect a memo from me this afternoon on tomorrow's status. For all tower, glebe, and garden residents, I want you to know that from time to time, you may receive a pre-recorded automated phone message from me with pertinent updates on the project. Holiday lights. In accordance with the governor's announcement, Westminster Canterbury Richmond plans to leave some outdoor holiday lights on display through January 31st to show our support for all that our healthcare heroes are doing to help end this pandemic. Salon Services. Salon Services plans to reopen Avalon Salon on Monday, January the 18th. Residents will be getting a call to confirm appointments toward the end of the week. We are scheduled to go into Gables starting the week of January 25th. Of course, these openings are subject to change. The main salon is the primary point of contact for all salon service requests. Please call extension 6281 when requesting an appointment. Wellness. The fitness and aquatic centers reopened by appointment only on Monday. Please remember that you must call to make your appointment. We are now accepting calls for next week's appointments. Small group classes have not resumed. We continue to offer Zoom classes Monday and Wednesday mornings. Contact a member of the fitness team if you would like to join. Studio arts programs. Beginning on Monday, January the 18th, the McGee Millheiser Arts Studio, McCord Pottery Room, and Gordon Woodworking Shop will reopen. The Art Studio and Pottery Room will be open on Mondays, Wednesdays, and Fridays from 9 a.m. to 4 p.m. A maximum of 4 people in the Art Studio and 2 in the Pottery Room will be allowed to maintain safe social distance. The Woodworking Shop will reopen on Tuesdays and Thursdays from 9 a.m. to 4 p.m. There will be a limit of 2 people at a time to allow for appropriate social distancing. Schedule studio time with Sarah Abernathy in the Art Studio or by calling 6268. And a message about security. There are a number of planned protests around the country. After the events of January 6th, Westminster Canterbury management and security staff are on heightened alert for any protests near campus. As we shared just before Election Day, Westminster Canterbury is not a political target, but that does not mean that we are not affected by the area and community around us. We have a very strong relationship with Henrico County Police, and if we need them, please be assured we can expect a quick response. If you have any concerns about this or any other security matter as we work to keep our community safe, please contact myself or Rob Robinson. Up next is Gayle Haglund.
Thank you, Glenn, and good to be able to talk with you today. So first, I understand that a few people around campus had sound problems again with the Saturday night movie. I'm sorry. We have tested the system the last couple of days and found that with that particular movie, the sound is rather quiet in a few portions, and that isn't fixable, but we've made adjustments, the ones that can be made. And we are re-airing The Sting with Robert Redford and Paul Newman tomorrow night, Wednesday, January 13th at 7 p.m. on TV 971. So again, The Sting will re-air tomorrow night, Wednesday, January 13th at 7 on TV 971. Now, I have some good news to share with you today. The foundation is very close to finalizing our reporting for 2020 giving. Now, normally, when a year is filled with turmoil and uncertainty, giving declines. And 2020 certainly had plenty of turmoil and uncertainty. On that, I'm sure we agree. But instead of stifling giving, 2020 seemed to have a galvanizing effect on your generosity. You knew times were challenging, and so you stepped up. The annual fellowship fund, which truly represents Neighbors Helping Neighbors, had a goal, as you know, of $1.65 million. Usually, we could count on about $150,000 or more of this coming from the resident-run shops on Main. But of course, that was impossible since COVID-19 began. Nonetheless, thanks to you, the full goal is over the finish line as we close the books this week. And we are amazed and so thankful. In fact, giving for 2020 is approximately finishing at $4.3 million, which is a terrific result for any year, but especially the one we just lived through. I want to thank each and every one of you so very much. Your gifts support fellowship, employee support through Weave, performing arts, healthcare excellence, memory support, pastoral care, fellowship outreach, and more. And you helped build a new spiritual center. So thank you. Thank you so much for making such an enormous difference. And now I'd like to share with you a very special and wonderful story of generosity. Late in 2020, a very generous family decided to make a very generous gift to Westminster Canterbury Foundation. And for now, this gift will be anonymous. But there's still a wonderful story to tell. The son of one of our dear residents encouraged his parent to consider creating a legacy gift. He knew his parent loved this place and might want to do something very special. The resident, her son, and I had many conversations exploring the options. It was decided that a gift to name the Spiritual Center's memorial garden was the most desired possibility. The gift is very large, $500,000. The donor decided to sign a pledge for half the amount and began paying that off in earnest immediately. The other half is set up as a future gift from the donor's will. What a beautiful idea. Our donor, though, kept pondering the idea of finding a name for the garden, knowing the memorial garden would be important to many people and families over generations. Surely, our donor thought, Scripture would inspire contemplation and joy. There is a story in the Gospel of Luke, chapter 24, in which two followers of Jesus walk the road to the village Emmaus. Along the way, they discuss the troublesome recent events in Jerusalem where Jesus had been crucified. They are joined along the way by a man they don't recognize, but who is able to explain these events through the lens of Scripture. The two ask this man to join them for dinner once they reach their destination. Their new friend blesses the food, and suddenly they recognize him as the risen Lord. In honor of this story, the garden will be named the Emmaus Garden. It is our donor's hope and our hope that the new memorial and contemplative garden be a place that celebrates each of our journeys to discover the divine, the Holy One. Thank you so much to this wonderful donor and to her son. And next up, Vanessa Perry.
Good afternoon. Join us for worship this Thursday starting 10:30 a.m. via TV 970. Leanne Ring, Pastoral Care intern, will be preaching, and Sally Maynard will be the musician. A reading from Psalm 3rd chapter, verses 4 through 6. I call out to the Lord, and he answers me from his holy mountain. I lie down and sleep. I wake again because the Lord sustains me. I will not fear, though tens of thousands assail me on every side. The following prayer is read aloud each day at Mount Vernon's public wreath-laying ceremony. It is adapted from George Washington's circular letter to the states, directed to the governors and states of the new nation. I now make it my earnest prayer that God would have the United States in his holy protection, that he would incline the hearts of the citizens to cultivate a spirit of subordination and obedience to government, to entertain a brotherly affection and love for one another, for their fellow citizens of the United States at large, and particularly for their brethren who have served in the field. And finally, that he would most graciously be pleased to dispose us all, to do justice, to love mercy, and to demean ourselves with that charity, humility, and pacific temper of mind, which were the characteristics of the divine author of the blessed religion, and without an humble imitation of whose example and these things we can never hope to be a happy nation. Amen. Please watch the next update, which will be this Thursday at 3 p.m.